Hi, my name is Rosana Navarrete Verduga. I am a student at Catholic University. I am going to talk to you about a randomized trial of endometrial scratching before in vitro fertilization. Definition: endometrial scratching with the use of a pipette biopsy is a technique proposed to facilitate embryo implantation and increase the probability of pregnancy in women undergoing in vitro fertilization.
In vitro fertilization is the procedure where eggs and sperm are combined in a dish outside the body to form a human embryo to allow us to transfer to create a pregnancy. I believe Stanford IVF Lab is one of the best because it meets 4 key criteria. One is we have state-of-the-art facilities. Number 2, we have highly qualified, passionate, experienced personnel. Thirdly, we follow evidence-based standard operating procedures that allow us to have consistent, high-quality outcomes. The fourth factor is the equipment that we use in the laboratory. We use state-of-the-art, current generation equipment that allows us to optimize the care for our patients. We have experienced reproductive endocrinologists, nurses, medical assistants, financial advisors, and front desk staff that all together work as a team to enhance the experience for our patients. If one needs or has concerns about their reproductive health or have been unable to conceive after 1 year of unprotected intercourse, they should come see a fertility professional at Stanford Fertility and Reproductive Health. We can help. We have the tools, we have the resources, we have the experience, we have the compassion. This is the place to come.
Application in medicine. In vitro fertilization is the most effective form of assisted reproductive technology. The procedure can be done using your own ovum or your partner's sperm, or in vitro fertilization could use ovum, sperm, or embryos from an unknown or anonymous donor. In some cases, you could use a gestational replacement, a woman who will have an embryo implanted in her uterus.
Infertility is actually a really large problem in the United States and all over the world. About 1 in 8 couples who are trying to get pregnant have trouble conceiving. In vitro fertilization is a great technology to help couples conceive. There are 5 simple steps to in vitro fertilization. The first step involves giving a woman medications, and we use injection hormones to grow her follicles. So the goal with in vitro fertilization is to produce more eggs than we would in an average month. In a typical ovulatory month, we recruit and ovulate 1 egg. With in vitro, our goal is to make 10 or 15 eggs. Then the second step is harvesting the eggs, and we do an egg collection. This is a simple procedure that is a type of minor surgery where you do get sedation and are put to sleep. Egg retrievals happen transvaginally, and we use a small needle guide to pass a needle over a transvaginal ultrasound to remove fluid from the follicles. On the same day of an egg collection, a sperm collection happens too, with a sperm sample being obtained. The third step is fertilization. This is when the egg and sperm are combined in the lab through different technologies of fertilization. One of those is ICSI, or intracytoplasmic sperm injection. After that, embryos are cultured, and the embryologists will observe the embryos as they divide from 2 cells to 4 cells and then 8 cells, and we watch as they have a growth, sometimes all the way up to 5 days out at the blastocyst stage where they have 100 or 125 cells. And the final step is the embryo transfer. During an embryo transfer, a woman's uterus is watched by ultrasound, and a small catheter is placed into the uterine cavity through the cervix. We replace the embryo or embryos there, And then we wait till 10 days later when we do a blood test in the serum to test for the pregnancy hormone. Going through IVF is a process that we endure together, and really an exciting moment is getting to make a phone call to a patient, giving her the great news that it has worked and that her pregnancy test is positive. It's by all means one of the most exciting phone calls I get to make.
Pros: helps many couples with fertility problems, helps to procreate women that are over 40 years with certain health problems. Cons: there may be multiple births, there may be complications during pregnancy or childbirth. It is not cheap.
Right from when we got married, it kind of felt like the clock was ticking, the countdown was on. And then you start thinking of other things. What if we can never have children? Then what do we do? When we did the insemination and that, didn't work, that was very disheartening because we had high hopes for that. We were diagnosed with unexplained infertility, and then that's when we moved on to the IVF. The first cycle that we did was really successful. So I went downstairs and I was like, well, they just called. And he's like, oh, okay, what'd they say? And I immediately just had all these emotions and started crying, and I was like, we're pregnant.
Really? Ah, you're crying. It looks like that's bad news. All right.
It's been such an amazing journey. They never made us feel like, oh, there's something wrong with you. They just always gave us that hope and reassurance. So, we'll definitely be forever grateful to them. Dex just brings so much joy to my life. Seeing his face light up or the smile on his face, nothing compares to that in life. I just can't imagine not having this experience.
Issue applied in Ecuador. In Ecuador, no public hospital does in vitro fertilization in its own facilities. This is only achieved privately. According to the Latin American Network for Assisted Reproduction, a scientific institution that gathers 90% of centers of this type in Latin America, 1,100 children have been born in Ecuador by assisted reproduction techniques from 1990 to 2011.
We've been trying desperately for 2 years to have a baby. We want so much to be parents. What alternatives are there to IVF treatments? Hello, I'm Dr. Bider, Director of the National Gianna Center for Women's Health and Fertility at St. Peter's University Hospital. Here at Gianna, we take a natural approach to helping women conceive. Our staff uses the Creighton Model Fertility Care System, a natural method for family planning, together with a natural procreative method of tracking a woman's cycle called naprotechnology, to get to the root causes of our patients' infertility. Our patients are taught to monitor and record the signs of their fertility using a simple yet specialized recording system. This is how we uncover rhythms of fertility, which then help us to predict the best times for our patients to try to conceive. Naprotechnology also helps us to diagnose subtle fertility problems that prevent our patients from getting pregnant. We work with our patients to create a treatment plan to correct these underlying problems, such as endometriosis, blocked fallopian tubes, cervical mucus problems, and more. We do this all without using the hormonal suppression traditionally used in women's healthcare. This suppression can cause these important underlying problems and clues to a woman's fertility to be missed. If you are considering alternatives to in vitro fertilization or would like more information on your needs, please call 732-565-5490. Thank you.
Conclusion. In vitro fertilization is a treatment for infertility or for genetic problems. Sometimes in vitro fertilization is the most offered health problems. Endometrial scratching did not result in a higher rate of live birth than no intervention among women undergoing in vitro fertilization.
Hello, my name is Dr. Brooke Rossi, and I am a practicing reproductive endocrinologist and infertility specialist. This micro video discusses lifestyle factors that may affect in vitro fertilization, or IVF, outcomes. Although many of the topics discussed also affect general fertility, for the purposes of the video, we are focusing on IVF. Several factors known to affect IVF success are listed on this slide. They include age, weight or body mass index, smoking, alcohol use, diet, vitamins, supplements, and stress. For the purposes of this video, we will focus on age, weight, and smoking. As we will discuss, increasing age and high or low body weight or body mass index decreases the chance of getting pregnant and having a baby with IVF. In addition, smoking also decreases success with IVF. Let's look at the SART website and data to demonstrate the impact of age on IVF outcomes. SART is the Society for Assisted Reproductive Technology. As you can see, as a woman ages through her late 30s and 40s, the chance of live birth, or the chance of having a baby from one IVF cycle, falls significantly. The chance of live birth falls because as women age, their fertility goes down and the chance of miscarriage increases. The result is a lower chance of having a baby. One of the major influences of IVF success is weight. We can understand the impact of weight by looking at the SART patient predictor. This patient predictor can be used to estimate a patient's chance of having a live birth with a fresh IVF cycle. It can be found at this website. It allows us to see the impact of weight and body mass index. In this example, if a patient weighs 140 pounds, her chance of having a baby is approximately 40%. However, if we hold her other characteristics the same, but change her weight to 240 pounds, we can see her chance of having a live birth is almost 10% lower. You can go onto the SART website and use this patient predictor to see how the impact of weight, as well as age, may affect IVF success. Smoking cigarettes during an IVF cycle may lower the chance of having a baby with IVF. Some studies looking at the effects of tobacco use show that women who smoke may have less eggs retrieved during IVF and have a lower chance of getting pregnant. Also, men smoking cigarettes can be harmful to IVF. Even regular secondhand smoke can affect IVF outcomes in a negative fashion. In summary, age, weight, and tobacco, as well as other factors, can affect IVF success. Although you cannot change your age, be sure to talk to your physician about your chances of IVF based on your age and other fertility factors. Try to be healthy when starting IVF. Finally, don't smoke and make sure others around you aren't smoking either.
Thank you.